wonderful lecture and giving us an alternative view on how to view the drug problem. Now, is Dr. Diaz here to give her reaction? So if she's not, then I will now open the floor from to questions from the floor. So if there's anyone who wants to ask questions, kindly introduce yourself and your affiliation before asking the question. I think Dr. Deongri has a question.
The photo of the supposed the dopamine receptors. So how many, my question, how many people who were taking drugs, what's the sample set? How many people were tested that were taking shabus, and how many brain scans that were controlled?
This was multiple, that one study, that one photo was about maybe 20 participants in each, but that one photo was one person compared to one person. So that was a photo of just one person. One methamphetamine user versus one non-methamphetamine in that one photo. But that photo is not data, that's just a pretty picture that is put up. But there are multiple studies that have been conducted with larger number of participants.
Does that mean that it was within the standard deviation?
Yes.
So it was an acceptable fact that there is a decrease in dopamine receptors in the...
Yeah, no, that was the point I was trying to make is that when you look at all of the data, when you put all the participants in, you compare, I don't know, 100 methamphetamine users to 100 controls. What you find is that you have a tremendous amount of overlap. They look like each other. And any difference is within the normal range of human variability. So it's just like you may be taller than me, but I'm not abnormal because I'm shorter than you.
Other questions? Yes.
Thank you very much, Professor Hart, for this presentation. I thought it was very interesting. Now, I'm trying to make sure I understood something. We've heard this morning from the previous speaker that the rate of addiction in the Philippines was lower than globally, right?
Yes.
And then you told us that there is a conflagration that is being made between drug use and drug abuse, and that in fact drug abuse in the medical sense of the word is actually a very small percentage of the overall drug use in a given country. So overall, if we were to quantify the actual drug problem in the Philippines, we'll have a very small, fairly small number if we take into account what we've heard this morning and what you've told us. Am I getting the implication correct?
You are.
Okay, so from a policy standpoint, I mean, even if it's a small percentage, it's still an important problem. It's still important for a society, of our people. So from a policy standpoint, what are your recommendations really?
From a policy perspective.
From a policy, yeah, you know, what kind of treatment, what kind of, what do we do? Even if it's a small percentage, what should be done for that small percentage of people who do have a real addiction problem? And what about the others? Do we just leave them?
Yes. From a policy perspective, so the first thing that people have to understand, that the drug problem is never about drugs. It's rarely about drugs. So if you understand that, and now you think about making sure you understand, like some of these people who actually meet criteria for addiction and they have a drug problem, they also have mental health problems. And so you want to make sure they're treated. Those people are treated. That's one way of dealing with it. Then there are other people who may be addicted for other reasons. And then you will have to, the medical community will have to implement strategies that are appropriate for them. But the medical community should have that training to do this. This isn't complicated. That part, the most complicated part is the assessment. And those sorts of things should already be in place. But what is happening is that people are being identified as being problematic drug users, overwhelming the system, and then decreasing the likelihood of the people who actually need help from getting their help. And so when we think about what we need, what I would suggest we do is that we first understand that most of the people who are drug users don't need help for drug use. Now, that's not to say that those people, some of those people, they may have some other issues. I don't know what those issues may be, criminal justice, whatever. But the issues should not be conflated. And that's what's happening in this case. And as long as we're conflating these issues, we're going to decrease the likelihood of the people who actually need the help. And then we might have to actually admit that the problem is not as large as we said it was. And that's a hard thing to admit.
Okay, I have a question, Professor Hart. Would you have any data on how effective rehabilitation of a drug addict is? Because I understand that drug addicts, those who have really the addiction, they tend to go back. They tend to, once they are rehabilitated, their addiction recurs, so they go back. So do you have any data on how to treat the addiction?
I don't know exactly what the drug rehab centers are like here, so it all depends on the center, obviously. But there certainly are good treatments. I don't know if they are available here or how accessible they are to people here. Sure, there are people who will go back to using drugs if treatment is not appropriate, not good. You would expect that. That's just like if you, for example, somebody breaks their leg and then they go to the hospital and then they give them an aspirin and then they go back because they have a broken leg because that treatment's not effective. That's not, so it has to be effective treatment. Effective treatment does work.
Good afternoon, Doctor.
Good afternoon.
I'm Daniel Lissing from the Institute of Human Rights. My question is, you earlier stated that the viable alternative as a policy is that you give attractive measures by which the person will be, I suppose, they will have alternatives to drug use. Could you propose these attractive measures are such that might help the policy?
Thank you. Actually, thank you for asking that question. The thing that we have to think about, us together, is that we should look at the population of people who are meeting criteria for addiction in this society. I would speculate that many of the people that we're talking about come from the lower classes, lack of jobs, lack of opportunities, a wide range of these issues. And so when we think about policy, it's important that people have meaningful employment, opportunities. All of these sorts of things help to keep people out of those undesired behaviors. And so if we're thinking about policies, let's make sure people have meaningful employment, meaningful opportunities. I know that's easier said than done, but when we think about reallocating monies to various job programs and those sorts of things, it can go a long way.
Hi, good afternoon.
Good
I'm
afternoon.
Alexander Valera. I'm a law student. I'm diagnosed with ADHD, and I'm prescribed with Ritalin. I just want to ask what the main difference is from shabu or methamphetamines as we know it here in the Philippines.
So the main difference from methylphenidate, Ritalin, and amphetamine, one of the main neurobiological differences is that so Ritalin, the bottom line is that both of these drugs increase the activity of certain neurotransmitters, the dopamine, norepinephrine, those neurotransmitters. Ritalin does it one way by preventing those neurotransmitters from being taken back up into the cell, and it continues to stimulate the receptors. Whereas shabu or amphetamine does it by causing a release of these neurotransmitters themselves. But the net effect is increased activity of these neurotransmitters.
Thank you.
Thank you.
Thank you very much, Dr. Hart, for your very informative presentation. I'm a human rights advocate, and we have recently conducted several fora on AJ case with communities, victim survivors of the drug war here in the Philippines. And one of the common themes that always come out in their testimonies, in their narratives, is that the problems of drug selling and drug trading is actually being perpetrated by the police themselves. There was even a quote that says, there will be no drugs if there are no police. Yeah? So my question is, these are very progressive insights, no? That you have shared with us. Have you done any initiatives with the police in the United States along this line? And what have been some of the outcome or best practice response from the police where you have tried these approaches in terms of looking at alternatives?
No, thank you for the question. It's a very sensitive question for me. You may know something about the United States, for example. In the United States, we have this issue where large numbers of black men die at the hands of police. And it's been a sort of a major issue in the papers. So I have not worked with the police. Well, when we think about these issues, employment, lack of employment, deprivation, social deprivation, being shut out of society, these are complex issues. Why would you want to let your police solve these complex issues that they are not qualified to solve? They just don't have the training. And they have the training to make sure that the laws are being enforced, and that's fine. But many of these issues are way beyond their expertise. And for us to ask them to solve these problems, it's not fair to them. And we ask them to solve these problems, and then we are concerned about the results. These are precisely the kind of results that we can expect if we're asking them to solve this problem. We know this. I live in a community in New York City where it's a well-to-do community. We don't ask police to solve those problems in our communities. We ask police to solve the problems of the poor because they can behave in ways that would be unacceptable in my community. And so I just caution us not to ask police to solve these complicated problems.
Um, I'm Aurora Parong. I'm a medical doctor. And I am a member of the Medical Action Group, and it has, in fact, made a commitment to be involved also in this. I'm just very sad that the representative from the Department of Health was not here to react to what you had informed us. There are so many things that I learned, and I think I can bring it to this NGO and see how we can really move forward. But I'd like to ask how well accepted or how much of what you're saying are accepted or mainstreamed in psychiatric organizations, psychological organizations, pharmacological, at least the
Pharmacological, yes.
Yeah, and the WHO,
yes.
Because I think the DOH would be looking at the WHO on how to go about it, at least maybe some of the WHO standards or guidelines in terms of dealing with drug abuse and drug addiction.
Thank you. Thank you. The question is how well accepted what I am saying. So it's a complicated question, but you should know that I served on the National Institute on Drug Abuse, U.S. National Institute on Drug Abuse Advisory Committee. I did a term, a 3-year term. That's the highest sort of committee in this area. Of course, I'm a tenured professor at an Ivy League institution, and you don't get that without having been accepted by the boys club or the club. You don't get that. I have lectured at WHO. I've lectured all around the world at the request of governments and so forth. I publish in the scientific literature. I publish more than most people in the scientific literature. I have books. I don't know what, are you convinced yet, or should I continue to talk?
No, I am convinced. It's just that it has to be mainstream. It has to get into policymakers.
Oh.
And I think it's the health profession who should be speaking about it.
No, you were absolutely...
And sad to say, no one in the Philippines has spoken about it yet. I don't have much information about drug abuse and drug addiction, but like I said, I learned a lot today.
Yes.
But,
No,
you know.
I understand your question now even better. It's a difficult one, the one that you raised, because I would be remiss if I didn't say that my position, I have come to this position after nearly 25 years of study. And it's a position that I've come to, or I'm certainly more out about this position after I am tenured, after I have become tenured, and I have achieved all of these things. And it's not a position that I would encourage young people on the way to take, because it's one that really challenges the field. And it requires anyone who takes this position to really know the literature and really know what they're talking about, because they will be challenged, and they will be vociferously challenged. And so it's difficult. You're absolutely right. But it's necessarily because it's right. It is the right position. It is not the most popular position, even in science. But you must understand, too, where I come from and who I am in the United States. I think you all know something about the United States and its racial discrimination. I think you all know something about that. So I'm one of few black scientists in the United States. And when it comes to drugs and drug policies, the community from which I come has been devastated, not by drugs, but by drug policy. So in the United States, black men, for example, represent 6% of the population, but more than 40%, or nearly 40% of the prison population. And drug policy has contributed to that. And so me, as a scientist, as a black scientist, I have to carefully think about the role that I may have played in promulgating or propping up those policies. So it forces me to look at myself on a regular basis, whereas my colleagues don't have the same need, don't have the same motivations. And so I understand your question very well. Thank you for asking it.
Thank you. I think I will be approaching you for more conversations about the issue, because I think that the views that you have given us, you have shared with us today, will be very important for the advocacy of the Medical Action Group in relation to these drug issues in the Philippines.
Thank you.
Okay, we have time for one last question. Thank you.
Hello, Dr. Hart.
Hello.
I'm Dino Manrique of the In Defense of Human Rights and Dignity Movement, or IDEFEN. My question is, Vice President Leni Robredo was in the news lately because she suggested looking to other drug policies, and she gave Portugal as an example. In your book, you said that the Portugal model was moderately successful, and I want to ask you what you mean by that, and if you would also recommend the Portugal model to the Philippines, knowing what you know about the Philippines.
Thank you.
Thank you.
I didn't realize that I modified the success of Portugal. I apologize to Portugal for doing that. That's just poor writing. What I meant is that the Portuguese model is successful for the Portuguese people. They're happy with it. I've been to Portugal and spoken with the folks who were responsible for this, and they're happy with this model, and the people of Portugal are happy, so it's successful. For you all who don't know, the Portuguese model is simply, they have decriminalized all drugs. That's everything from shabu to heroin to cocaine, everything. Decriminalization in their model simply means that people who are caught possessing a 10-day supply or less of the drug will not be subject to criminal prosecution. They might be subjected to administrative fines or not, but they certainly will not go to jail. And that model has been in effect since 2001. But it's not only in Portugal, it's the Czech Republic. The Czech Republic actually did it before Portugal, but Portugal has a better sort of marketing department. So we know about Portugal. And it's been successful. And I have certainly advocated for that in the United States. The bottom line is that if we are really concerned about keeping people safe, we would absolutely look at countries that have been successful. And the Portuguese model is certainly one. And so when we think about the Philippines, absolutely we can look at that model. But that model requires some compassion for people who use drugs. It requires that the society sees drug users as themselves. As long as your society is allowed to separate itself from drug users or think of drug users as others, you can expect your current situation to continue. Thank you.
Okay. Thank you, Professor Hart, and thank you to all those who asked their questions. May I request Doc Cora and Attorney Chi